Introduction. Double aortic resection, particularly involving both the upper and lower valves, is a complex surgical procedure often discussed in advanced cardiovascular care. This procedure, typically performed by specialized cardiothoracic surgeons, addresses severe cases of aortic valve disease or complications that cannot be managed with more traditional approaches. In this blog entry, we'll delve into what double aortic resection entails, why it might be necessary, and what patients can expect from the procedure and recovery. What is double aortic resection? Double aortic resection refers to the surgical removal of affected parts of the aorta and its associated valves, both the upper, or aortic root, and lower, or aortic arch and descending aorta sections. The term double signifies that both areas are addressed in one surgical session. The procedure often combines techniques from aortic valve replacement or repair and aortic resection or grafting. Upper valve resection. This involves addressing issues related to the aortic root, which can include replacing or repairing the aortic valve and potentially involving the ascending aorta. Conditions like aortic stenosis, aortic regurgitation, or aortic root aneurysms might necessitate this type of intervention. Lower valve resection. This pertains to the descending aorta and can involve replacing or repairing sections of the aortic arch or descending aorta. It might be required in cases of aortic dissection, aneurysms, or severe atherosclerosis. Why is double aortic resection necessary? Double aortic resection is generally considered in complex cases where traditional treatments are insufficient. Some of the reasons a patient might need this procedure include aortic aneurysm. Severe dilation of both the ascending and descending portions of the aorta can weaken the vessel wall, increasing the risk of rupture. Aortic dissection. This condition involves a tear in the aortic wall, creating a split that can extend through the entire length of the aorta, requiring repair in multiple segments. Complex valve pathologies. Some patients may have multiple valve issues or complicated valve disease that affects both the aortic root and descending aorta. The surgical procedure. Double aortic resection is a high-risk, high-reward procedure that requires meticulous planning and execution. The surgery typically involves preparation. Patients undergo extensive preoperative evaluations, including imaging studies like CT scans or MRIs, to precisely locate and assess the affected areas of the aorta. Anesthesia and incision. General anesthesia is administered. Surgeons make an incision along the chest to access the aorta. In some cases, a more extensive incision might be necessary to reach both the upper and lower sections of the aorta. Resection and reconstruction. Surgeons carefully remove the damaged sections of the aorta and replace them with synthetic grafts or perform valve repairs. The complexity of this step depends on the specific conditions and extent of the damage. Closure and recovery. After the resection and reconstruction, the chest is closed, and the patient is monitored in an intensive care unit, ICU, for recovery. The goal is to stabilize the patient and ensure that the new sections of the aorta and valves are functioning correctly. Postoperative care and recovery. Recovery from a double aortic resection is often lengthy and involves several stages. Immediate postoperative period. Patients typically spend several days in the ICU for close monitoring. This period is crucial for detecting any complications and ensuring stable hemodynamic function. Hospital stay. After the ICU, patients generally remain in the hospital for additional recovery. This stage involves pain management, respiratory therapy, and gradual mobilization. Long-term recovery. Full recovery can take several months. Patients may need to adhere to a specific rehabilitation program, including physical therapy, lifestyle modifications, and regular follow-up visits with their cardiothoracic surgeon. Risks and considerations. As with any major surgery, double aortic resection carries risks, including infection, bleeding, and complications related to the heart and lungs. It's essential for patients to discuss these risks with their healthcare team and weigh them against the potential benefits of the surgery. Conclusion. Double aortic resection is a sophisticated and life-saving procedure for patients with severe aortic conditions that cannot be managed through less invasive means. It represents a critical option for those with complex aortic pathologies and involves a challenging yet potentially life-extending approach. If you or a loved one are considering this procedure, it's crucial to work closely with a skilled cardiothoracic surgeon to understand the risks, benefits, and the expected journey towards recovery. For more information and support, consult with healthcare providers who specialize in cardiovascular care, and don't hesitate to seek out second opinions if needed. Your health and well-being are paramount, and having a comprehensive understanding of your treatment options is the first step toward a successful outcome.